Guys, a lot of you have been asking questions about fieldwork, and as an occupational therapy assistant student, that's one of the best things you can be asking about. Fieldwork is where you learn and you grow as a therapist, especially considering OTA school compared to OT school is a lot shorter and more condensed. You learn more as you go. So here is a little bit about my experience. We're going to talk about the settings. We're going to talk about which settings that I had my experience in, and then I'll give you a few tips and tricks in order to get through your fieldwork. So first and foremost, you should know which settings are available and out there. This is not all of them, this is just a handful. There's outpatient pediatrics, there's school system, there's inpatient adult, inpatient pediatrics, there's acute care, which is along with the inpatient, there is state hospital, chiropractic cares, skilled nursing facilities, which are also called SNFs. There's hand clinics, state hospitals. I think I might have said that twice. There are a lot of settings. So for me personally, my level 1, which is 1 to 2 days a week, I had at a daycare center for Alzheimer's patients. So I had 2 rotations in that. I also had a rotation in a small hospital that was acute care, and then I had a skilled nursing facility rotation. For my level 2 field work, which is full-time for 8 solid weeks, I had acute care again at a bigger hospital after I requested it, and I had outpatient pediatrics, which is how I landed my first job. Something that I've learned in these settings is that each setting is going to be wildly different. As I said previously, my acute care experience at one hospital is very different than my second one. A component of that is, again, the setting, but also the fieldwork educator. So something very important for you to know and understand is that if you are not working out with your fieldwork educator, you need to communicate your needs. If it's something that can be solved, talk to them about it. Ask for more visuals if you need them. Tell them you're not understanding something. If you're not comfortable with them, talk to your fieldwork coordinator who set the whole thing up in order to get some advice to make it through. I struggled with one of my fieldwork coordinators, and I had to arrange and figure out how to make it through those 8 weeks. But it taught me how to adapt, work with people, and she was a phenomenal COTA. I learned so much from her, even though personally things weren't working out from a student therapist perspective. Again, if it's not working out, figure out a plan, talk to the person from your school that set it up, and figure it out. One of my other classmates didn't make it through because he was struggling with his fieldwork educator. So don't let that be you. It's 8 weeks. You can make it through, you can graduate, and you can do this. My other level 2 fieldwork educator, we clicked really well. I told her what was working and what wasn't working every single week. Make sure that you communicate your needs to your fieldwork educator. They're also called clinical instructors, CIFE. You'll figure that out with whatever program you're at. My general advice, make sure to carry a notebook with you. It's just not very professional to be on your phone taking notes, and there's going to be so many diagnoses and words and treatments that you're going to be interested in and you want to look up. Write them down, write down your questions, write down the questions that you might not be able to ask your therapist in the moment, but that you can ask your therapist later on. Just bring a notebook with you. I had a small little tiny one that I can put in my scrubs. It was one of the most important tools. 2, you can journal every day. So I only did this for the end of my clinical experience after an OT student suggested it, but that journal has helped me immensely. Even back in OT school, I refer to some of my notes from that clinical experience as a OTA student. So make sure to write those things down. And then the last piece of advice is get there early. Get there early and read charts, read notes. Even if your therapist doesn't get there as early, maybe someone else can let you in. I think that having some time to give yourself space to read notes and charts and make your plans for the day will help keep you calm and collected, looking professional, and just being a rock star in your clinic. Well, anyway, let me know if you have more questions, and thanks for watching.